if the easiest way to think about it is, does your device have software, number one? And number two, does it have any possible way to connect to the internet? That's number two. If it meets those two criteria, then it is a cyber device. And a lot of the ambiguity comes around that second criteria I listed there.
Cybersecurity in MedTech is a topic that sometimes creates a bit of confusion. So today I'm with Christian Espinosa from Blue Goat Cyber, and he will play with me today something different. We're going to play Mythbusters, and we're going to dive into some truth or fictions in cybersecurity. So let's start. Christian, thank you very much for being with us today.
All right, I'm ready.
Ready?
Yeah.
Okay, so let's start. Myth number one. If it's FDA approved, it must be secure.
False.
Why?
FDA approval just means you've met the minimum requirements for the FDA, but there are still additional things you should do. And there's also been a case recently where a company basically falsified their submission to the FDA. They got approved, and then a whistleblower came forward to say they falsified the submission, and this device, which is a genetic sequencing device, was really not secure at all. So there was a false assumption that it's secure, because people can slide things through the FDA to get approved without actually doing the security.
Okay, number 2. Hackers don't target medical devices. They are after banks.
Hackers may not target a medical. Oh, sorry, false.
False.
Hackers often don't target anything specifically. They have malicious software that is propagating the internet looking for a vulnerable target. And if the vulnerable target happens to be a medical device, then that device is going to be compromised, often with something called ransomware, because the hackers are trying to make money. And if they can compromise any device that people depend on, then they can hold it hostage until you pay them the ransom. That's typically the way they make money. So medical devices are going to be targeted because they're on a hospital network, which is a hostile network, we like to say, because they're always under attack.
Good, so we go for the third one. Only hospitals need to worry, not device manufacturers.
I'm sorry, what was it?
Only hospitals need to worry, not device manufacturers.
False. Device manufacturers need to worry because if there's an issue with their device, somebody hacks into, let's say, a surgical robot, and that robot causes somebody to be paralyzed or kills a patient, who do you think is going to be liable? It's going to be the hospital a little bit, but it will go back to the medical device manufacturer as well. Plus, it's not going to be good for their brand if their devices are compromisable, which will hurt their business as well.
We go for the number 4. AI will solve cybersecurity automatically. Cybersecurity risks automatically.
False. AI, we like to think it will help with cybersecurity, but it actually introduces a lot of issues with cybersecurity. The reality is, it's kind of like AI versus AI. The people trying to defend their environments use AI, but the people trying to attack the environments use AI as well. So it's basically which group is better at training AI, the attackers or the people producing the product and the people trying to defend their device?
You were actually talking about it earlier in your panel discussion.
Yeah, I mentioned it earlier on the panel because I think we're a little premature for AI and MedTech, especially when it's used for some sort of therapeutic solution, such as counseling or therapy. There was a case not too long ago where with a counseling app or a therapy app, a suicidal patient was getting counseled by the AI chatbot. And at some point, the AI chatbot told the patient to go ahead and kill themselves. The patient killed themselves, and now the family is suing that company because we like to think about AI in terms of when it gets things right, but not when it gets things wrong. But in a medical device or healthcare use case, when it gets something wrong, the consequences can be pretty dire,
Indeed.
like the one I just mentioned.
And to finalize, number 5, cybersecurity slows down innovation.
False. The lack of cybersecurity slows down innovation, and that's a good myth because people often think that. But from our experience, when medical device manufacturers don't consider cybersecurity and they try to do a submission, then it's slowed down because they have to go try to retroactively add cybersecurity to their device. Whereas if they would have designed it into the device at the beginning, it would have actually sped up their time to market.
Indeed. Well, a lot of faults around cybersecurity, but today in MedTech World Singapore, we are here to solve those issues, right?
That's right. We're trying to raise the awareness because I feel like it's an awareness challenge in MedTech.
Thank you very much, Christian, for being with us today, and hope to see you in the next event.
Awesome. Thanks so much, Shara.
So an issue can be if you're feeding in, some grainy images into the AI and it's not getting a good understanding of how to look for something like cancer. It's obviously not going to have the information that it needs to make the correct diagnostic call. And so you're going to get inconsistent results and you might trigger a misdiagnosis. So I think the training data is a pretty critical thing that needs to be considered.
I feel like cybersecurity 101 is you cannot defend or protect something that you don't know exists. And so getting an accurate and up-to-date inventory is always priority number one. And so my read on how the industry has reacted is for a long time, a lot of people were maintaining these lists of both open source and commercial components that they were using in very, archaic ways, right? Typically Excel sheets, which I love Excel, it runs the world, no problems with that. But it is really difficult for people to ingest Excel sheets at scale and then be able to do any type of ongoing analytics about that. In particular, as we know, new vulnerabilities appear every day for existing open source or closed source packages.
Talk about security by design principles, total product lifecycle approaches. They have all sorts of different buzzwords they use to say the same thing, which is that you need to integrate security all the way from the beginning, all the way to the end. It can't be a one and done process. Why this is a little different from biocompatibility or sterility or human factors or any of that is that there are so many small changes that can affect security. Anytime you're doing anything to the software, there's a risk that you're introducing new security problems. And so given that the development of a medical device might contain hundreds or thousands of iteration of source code, of software, of deployments before you get to a final design freeze in your final product, there are so many spots where this can go wrong. So if you have a process in place to check each time you're making changes, have a continuous integration or deployment process that is building security into your development practices, you're far less likely to introduce risk into the system as compared to if you just did it in a block of time. You said, we're going to do this once and we're going to be done. We're going to do it right at the end. And then we start our penetration tests and our testers uncover 3,000 vulnerabilities, which we could have fixed if we handled it as more of a total product lifecycle approach.
I do want to think of ourselves way more than just purely an event organizer or a media company, but essentially someone who's looking to bring the ecosystem together and leverage the connections we're building across different countries and cultures. Asia, we've mentioned Asia, we've mentioned Middle East, Europe and North America. When different cultures, different industries come together, there's a lot to learn from each other.
There's a lot to learning how to use AI. I just did some training this morning with my team, the sales team, on how to do prospecting using AI and using other tools. But it's interesting because AI will give you an answer, but if you say, give me the best you got, it'll give you a better answer. Then you say, give me one better. It'll just keep getting better. But it's like, why didn't it give you the best one initially? So I always, when I'm teaching people about AI, it's like, if you tell it you want a good message, it's going to give you a good one. If you tell it you want an outstanding message, it'll give you something better. So it's like these little things that people don't think about with AI from a literacy perspective. It's really, like you said, it's going to become about how good somebody is at using AI, really. And that will determine their success with AI and how much they understand about it.
So oftentimes you can see some examples that have been done by security researchers in the past at events like Black Hat, where they have Bluetooth sniper rifles, for an example, which sounds like a ridiculous concept, but they look like sniper rifles that I believe have a range of around 1 kilometer to send and receive Bluetooth signals with super, super targeted, precise antennas. So there can be some edge case scenarios. And one example we always talk about is the fact that Dick Cheney wanted his pacemaker removed due to the fact that he was afraid someone could use something like a Bluetooth sniper rifle to try to assassinate him and control his pacemaker.
$50 to 55% of companies literally shut their doors because of low customer adoption of the products and services they offer within 5 years. 72 to 77% of companies shut their doors before they get to blow out their 10 candles for their 10th year anniversary. So the stack is the deck of cards are stacked against business success. And people say, well, Craig, business is more than just the financial success. No, it's not. Because if the business is not sustaining itself, it cannot serve the world in the products and services that these people need.
I think it's worth going over some of the typical interfaces that make your device a cyber device. Like, obviously, if you have Wi-Fi, that's one. Cellular, that's another. And we've seen devices, all these. Bluetooth, low emission, we see that quite a bit. That makes it a cyber device. A USB port makes it a cyber device. A serial port, the FDA guidance clearly states that makes it a cyber device. Magnetic coils, that makes it a cyber device. So this would be like RFID or NFC. And then even something like HDMI, which most people think is just used for display, can make your device a cyber device.
This is not an ideal situation. So the FDA is now saying, okay, we get it. Some of these legacy products, you need to make other changes. If you're doing that, here's what we see as a good effort for cybersecurity. And that goes into the eSTAR changes. The FDA is going to want to see for these legacy devices with changes not relating to cybersecurity. Generally, those would be authentication, updates, data flows. You can go through that uncontrolled risk assessment, talk about what your plan is for ongoing post-market maintenance and monitoring, and provide a software bill of materials as a reduced burden pathway. So that's the shift that the FDA is trying to make to get manufacturers to do, I don't want to say a good enough job, but essentially just cover some baselines for security without needing to do costly redesigns that could potentially take valuable products off the market.
What quality often tries to encourage is taking a preventive approach. Look for something that may potentially go wrong and put something in place to make sure that thing doesn't go wrong in the future. So yeah, I would somewhat agree with that. Whereas a regulatory, that's more about, getting that market approval, getting the product out there and filling that. Whereas quality is more like a process on the whole thing. So regulatory is for your product, where quality itself is on the company as a whole. And quality really is not a department. It's more of a culture.
You need to build a device with Secure Boot in mind. You can't just slap it on at the end. It's not a little box you tick. You have to build it with that consideration, start to finish. So there will be times where someone will come to us with a device and I'll ask them, do you have Secure Boot enabled? And they go, no, we don't. And we need to submit in a month. We can't redesign the entire product in a month. So then it becomes a lot more difficult to figure out how are we going to handle data integrity in this system where the features aren't built in. So that's something that people should think about from that design perspective. There can also be a lot of just inherently insecure functionalities. Oftentimes, we'll have a lot of back and forth with clients on, we want to have, a connection to the internet. And that can be great for a lot of reasons. You can do remote monitoring, updates, maintenance. You can make any changes from the cloud, but that means bad guys can see it from the internet.
I don't think people are going to really think about that risk. And it is a risk that I think people need to think about. And most people nowadays are probably going to go say, hey, my doctor says I need this procedure, and type it into ChatGTP and say, what risks should I be worried about? So I'd be curious to know what it would spit back out, if it would even bring up the cybersecurity risk or not.
If AI is providing additional context, that burden is still going to be on the clinician to ensure that it's providing accurate information. They are making the best, most informed decision for the patient. If the AI itself is making these decisions, if AI is trying to diagnose or prescribe, then it is going to get quickly very complicated, since the liability is going to be bit more on the AI side of things, on the manufacturer, on the healthcare delivery organization for integrating that AI, on the regulators for approving that AI. There are so many different things that can go wrong in that context. And so it needs to be done very well. And that can be hard sometimes.
So we hire pen testers permanently to constantly try to breach our systems. We have cybersecurity just top of mind, always, because of that. And with the emergence of large language models in the past couple of years, right? It's really opened up traction for connected devices and pure software as medical devices in the MedTech space. And that has really fueled the growth in the MedTech market. And so we're seeing cybersecurity be top of mind for a lot of
We're
people.
not saying that the data is not important. It's just from a priority perspective, is less important than the patient safety. I mean, imagine if you have a defibrillator and someone is shocking you to death at the same time they're stealing your protected health information. Which one would you care about more, right? Probably being shocked to death.
I'd probably want to live to be upset about my data getting stolen personally.
But now all I'm seeing is, one of the first few questions clients ask us is, what do we do?
So let's jump into a little bit here. Like, from your experience, how do you feel the industry is shifting in terms of cybersecurity and like quantum computing, just like in general? Because it sounds like you've been in the industry for a while. Like, how do you see things shifting?
Yeah, so that's a really interesting topic. And I think one of the things that people are more aware now is definitely the cybersecurity aspect of compliance. I think when I started in the industry, I don't think cybersecurity was quite that big of a topic. But now all I'm seeing is, one of the first few questions clients ask us is, what do we do? How do we make our device more secure? And you're seeing that from the regulators as well. They're coming out with more guidances, more regulations, standards of secure by design, essentially. So it's moving out of thinking about compliance maybe at a later stage or like post-launch security compliance, but now it's really weaving the security requirements into design control itself, thinking about those security aspects right from the very start.
And when I first started working on medical devices in 2014, it was an IVD system. And the two areas that had the most impact to patient safety were denial of service and delayed service. So an example is someone has sepsis, which their blood is toxic, and they can't get the result because the system went down or the result is delayed. So it's not just purely denial, it's also delayed. Then they could die because sepsis can kill you if your blood is toxic.
If 1,000 things go wrong with an oxygen pump, it's probably not going to deliver oxygen anymore, but it's not realistically going to hurt an individual. If there's a pacemaker and pretty much anything goes wrong, that could lead to the individual dying pretty quickly. So it is based on the outcome as opposed to the input that leads to the outcome. That is what we're mostly looking for. So uncontrolled risk is a situation that is dangerous based off of the context and use case of the product.
If they've got that in their minds, they're going to also want to make sure that's protected both ways. They want to make sure there's no harm to patients done. They want to make sure, if this thing is connected to the internet somehow, people can't get into it or different ways and harm patients, because that is a pretty short ride for a company if you get that kind of press early on. And then the second thing they want to do is they want to protect their data. They are terrified of bad actors around the world scooping up either data from the company is one side of it, but they're really concerned about all those insights coming off, like from smart robots, for example, that all that data, which is really valuable to get insights and to do, a lot of training models for AI and stuff. They're very scared that people might siphon a lot of that off.
Wait to the very end often. And that's why we're doing these podcasts and why we're doing a lot of content creation to raise that awareness so people start engaging cybersecurity early on, because it's really from design to disposal, that entire life cycle, we need to consider cybersecurity, not just a block of time.